Hi, Dr. Raj here, and today we're going to talk about how to classify scleroderma for the board exam. That could be a confusing topic. So, I start off by classifying scleroderma into two main categories. Number one, could it be localized? Number two, is it systemic? If it's going to be localized, it means it only involves the skin. And another word for that would be called morphia. And morphia has different subtypes. It can be categorized as circumferential. It can be categorized as linear. It can be generalized. But the key word is it's only localized to the skin. It doesn't have internal organ involvement. The other category is systemic, and that can involve any organ in the body. And under systemic sclerosis, I put two traditional categories. One will be limited. And when we talk about limited scleroderma, many of you use the acronym, the CREST syndrome, which is great because it helps you remember calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, telangiectasias. So that's going to be that CREST syndrome known as limited scleroderma. The other one under systemic sclerosis can be diffuse. Now, the key thing is what separates limited from diffuse is the amount of skin involvement. And many rheumatologists will use a scleroderma skin score to determine this. But the take-home message is that any organ can be involved, whether it's going to be limited or it's going to be diffuse. And being the pulmonologist, there are two things I always worry about in scleroderma patients. Do they have pulmonary arterial hypertension, or are they developing interstitial lung disease that can lead to pulmonary fibrosis? Now, I just want to mention a couple of other categories. One is going to be scleroderma can be part of the overlap syndrome, meaning that it can be associated with rheumatoid arthritis, myositis, lupus, Sjogren's. So is it part of this overlap syndrome? And the last thing is that this is also rare. You could have syn scleroderma, meaning no skin involvement, but you could have internal organ involvement. Wow, that is rare. So please, I hope this way to classify scleroderma is going to be helpful for your board exams. Start off with an ANA in the serological evaluation. If we talk about limited scleroderma, think about anti-centromere antibody. For diffuse, think about anti-topoisomerase, and those are my pearls for your board exam.